Are you curious about Focalin and wondering what it is used for? In this video, we will explore the primary conditions that Focalin is commonly prescribed for, provide dosage guidance, discuss potential side effects, and share some user feedback. Focalin is a medication that belongs to the class of drugs known as central nervous system (CNS) stimulants. It is mainly used in the treatment of attention deficit hyperactivity disorder (ADHD) in children and adults. ADHD can significantly impact a person's ability to focus, concentrate, and control their impulses. Focalin works by increasing the levels of certain chemicals in the brain, which helps to improve attention and reduce hyperactivity and impulsivity. Apart from treating ADHD, Focalin may also be prescribed off-label for other conditions such as narcolepsy, a sleep disorder characterized by excessive daytime sleepiness. Before starting Focalin, it is essential to consult with a healthcare professional who can guide you on the appropriate dosage based on your age, weight, and the severity of your symptoms. It's also crucial to be aware of potential side effects that Focalin might cause, including decreased appetite, trouble sleeping, and increased blood pressure. To get a better understanding of how Focalin works in real-life situations, we will also include some user feedback. So, stay tuned to learn more about Focalin and its various applications. What is Focalin? Focalin is a medication that belongs to the class of drugs known as central nervous system (CNS) stimulants. It is mainly used in the treatment of attention deficit hyperactivity disorder (ADHD) in children and adults. ADHD can significantly impact a person's ability to focus, concentrate, and control their impulses. Focalin works by increasing the levels of certain chemicals in the brain, which helps to improve attention and reduce hyperactivity and impulsivity. Primary conditions addressed by Focalin. The primary condition that Focalin is commonly prescribed for is ADHD. ADHD is a neurodevelopmental disorder that affects both children and adults. It is characterized by symptoms such as inattention, hyperactivity, and impulsivity. These symptoms can have a significant impact on a person's daily life, including their academic performance, work productivity, and relationships. Focalin helps to alleviate these symptoms by increasing the levels of dopamine and norepinephrine in the brain. These chemicals play a crucial role in regulating attention, focus, and impulse control. By increasing their levels, Focalin helps individuals with ADHD improve their ability to concentrate, stay on task, and control their behaviors. Apart from treating ADHD, Focalin may also be prescribed off-label for other conditions such as narcolepsy. Narcolepsy is a sleep disorder characterized by excessive daytime sleepiness, sudden loss of muscle tone, cataplexy, sleep paralysis, and hallucinations. Focalin can help manage the excessive sleepiness associated with narcolepsy and improve wakefulness during the day. Dosage guidance for Focalin. Before starting Focalin, it is essential to consult with a healthcare professional who can guide you on the appropriate dosage based on your age, weight, and the severity of your symptoms. They will consider various factors to determine the most effective and safe dose for you. For children with ADHD, the initial dose of Focalin is usually 2-5 mg once daily. The dose can be gradually increased by 2-5 mg per week, based on the individual's response and tolerance, up to a maximum daily dose of 20 mg. The healthcare professional will closely monitor the child's progress and adjust the dosage as needed. In adults with ADHD, the starting dose of Focalin is typically 5 mg twice daily. The dose can be increased by 5 mg per week, up to a maximum daily dose of 40 mg. Again, the healthcare professional will closely monitor the individual's response and adjust the dosage accordingly. It is important to follow the prescribed dosage and not to exceed the recommended maximum daily dose. Taking higher doses can increase the risk of side effects and may not provide additional benefits. Potential side effects of Focalin. Like any medication, Focalin can cause side effects. The most common side effects reported with Focalin include decreased appetite, trouble sleeping, and increased blood pressure. These side effects are usually mild and temporary, but if they persist or become bothersome, it is important to consult with your healthcare professional. Other potential side effects of Focalin may include headache, stomachache, nausea, dizziness, irritability, and anxiety. Some individuals may also experience a loss of weight or slowed growth, especially in children. Regular monitoring of growth and weight is necessary when using Focalin long-term. In rare cases, Focalin can cause more serious side effects such as chest pain, shortness of breath, rapid or irregular heartbeat, and signs of psychosis, hallucinations, delusions, or mania. If you experience any of these symptoms, it is crucial to seek immediate medical attention. It is important to note that not everyone will experience side effects from Focalin, and the severity and occurrence of side effects can vary from person to person. Your healthcare professional will weigh the potential benefits against the risks and monitor you closely to ensure the medication is safe and effective for you. User feedback on Focalin. To get a better understanding of how Focalin works in real-life situations, let's take a look at some user feedback. It's important to remember that everyone's experience with medication can vary, and what works for one person may not work the same for another. I have been taking Focalin for my ADHD for a few months now, and it has made a significant difference in my ability to concentrate and stay focused. I used to struggle with distractions and would often lose track of time, but Focalin has helped me stay on task and complete my work more efficiently. The only downside is that it does suppress my appetite, but I have been working closely with my doctor to find ways to manage this. My son has been on Focalin for his ADHD, and we have seen a remarkable improvement in his behavior and academic performance. Before starting Focalin, he had difficulty sitting still and paying attention in class. Now, he is more engaged and can follow instructions without constant reminders. We are incredibly grateful for the positive impact Focalin has had on his life. I tried Focalin for my narcolepsy, and it significantly helped with my excessive daytime sleepiness. I used to struggle to stay awake during the day, which made it difficult to perform my job. Since starting Focalin, I have noticed a significant improvement in my wakefulness, and I feel more alert and focused. The only downside is that it can sometimes cause difficulty falling asleep at night, but overall, the benefits outweigh the side effects for me. These are just a few examples of user feedback, and it is important to consult with a healthcare professional to determine if Focalin is the right medication for you or your loved ones. Focalin versus other ADHD medications. Focalin is one of several medications available for the treatment of ADHD. Other commonly prescribed medications include Ritalin, Adderall, and Concerta. These medications belong to the same class of drugs known as CNS stimulants, and they work by increasing the levels of dopamine and norepinephrine in the brain. The choice between Focalin and other ADHD medications depends on various factors, including individual response, tolerability, and specific needs. Some individuals may find one medication more effective than others or may experience fewer side effects with a particular medication. It is important to work closely with a healthcare professional to find the right medication and dosage that works best for you or your loved ones. How to talk to your doctor about Focalin. If you or your loved ones are considering Focalin as a treatment option, it is important to have an open and honest conversation with your healthcare professional. Here are some tips to guide your discussion. Prepare a list of questions and concerns. Before your appointment, write down any questions or concerns you may have about Focalin. This will help ensure that you cover all the necessary topics during your discussion. Provide a detailed medical history. Be prepared to share your or your loved one's medical history, including any previous or current medications, allergies, and existing health conditions. This information will help your healthcare professional make an informed decision regarding the suitability of Focalin for you. Discuss your goals and expectations. Clearly communicate your goals and expectations for treatment. This will help your healthcare professional tailor the treatment plan to meet your specific needs. Ask about alternatives. Inquire about alternative treatment options, including non-medication approaches and other medications that may be suitable for you or your loved ones. Remember, your healthcare professional is there to support you and provide guidance. Together, you can make an informed decision about whether Focalin is the right choice for you. Tips for managing Focalin side effects. If you experience side effects while taking Focalin, there are several strategies you can try to help manage them. Here are some tips. Decreased appetite. If Focalin suppresses your appetite, try eating smaller, more frequent meals throughout the day. Focus on nutrient-dense foods that provide essential vitamins and minerals. You can also consult with a registered dietitian for personalized guidance on maintaining a healthy diet while taking Focalin. Trouble sleeping. If Focalin interferes with your sleep, practice good sleep hygiene. Create a relaxing bedtime routine, avoid caffeine and stimulating activities close to bedtime, and ensure your sleep environment is comfortable and conducive to restful sleep. If the issue persists, discuss it with your healthcare professional, as they may adjust the timing or dosage of your medication. Increased blood pressure. Regularly monitor your blood pressure while taking Focalin. If you notice a significant increase or have a pre-existing cardiovascular condition, inform your healthcare professional immediately. They may need to adjust your dosage or switch you to an alternative medication. It is important to communicate any side effects you experience with your healthcare professional, as they can provide guidance and suggestions to help manage them effectively. Focalin alternatives and natural remedies. While Focalin can be an effective treatment option for ADHD and narcolepsy, it may not be suitable or preferred for everyone. Fortunately, there are alternative treatments and natural remedies that can be considered. Here are a few examples. Behavioral therapy. Behavioral therapy, such as cognitive behavioral therapy, CBT, can be an effective complement or alternative to medication. It focuses on teaching individuals with ADHD strategies to manage their symptoms and develop healthy coping mechanisms. Other medications. If Focalin does not provide the desired results or causes intolerable side effects, your healthcare professional may recommend trying other ADHD medications such as Ritalin, Adderall, or Concerta. These medications work in a similar manner but have slightly different formulations and durations of action. Natural remedies. Some individuals may prefer to explore natural remedies for managing ADHD or narcolepsy symptoms. These can include dietary modifications, regular exercise, mindfulness techniques, and herbal supplements. It is important to discuss these options with a healthcare professional before starting any natural remedies, as they can provide guidance and ensure safety. Conclusion. Focalin is a medication commonly used in the treatment of ADHD and narcolepsy. It helps individuals improve their ability to focus, concentrate, and control their impulses. It is important to consult with a healthcare professional to determine the appropriate dosage and to be aware of potential side effects. User feedback can provide valuable insights into the experiences of individuals who have used Focalin. Remember to have an open and honest conversation with your doctor when considering Focalin as a treatment option, and explore alternative treatments or natural remedies if needed. With the right guidance and support, you can make informed decisions about your or your loved one's healthcare.